Hello, my name is Robert Pollock, and this is the standardized patient encounter reflection video for ATTR 356. So this patient was presenting with general medical conditions. So the patient had very much demonstrated flu-like symptoms. So, for example, headache, nausea, vomiting, full body aches, hot and cold flashes, and just overall wasn't feeling very good in any of the activities he was doing. So overall for me, I felt like before and after the debrief session that I did pretty much everything that I needed to do, and that there were things that I could improve, but for kind of dealing with this for very limited amount of time, so I'd only had a couple exposures, probably less than 5 exposures to a general medical condition before the standardized patient. I thought, considering that, everything went pretty well. So I guess kind of touch on some of the things that I think went well for myself with this patient is that I believe I had a pretty comprehensive history that included sexual activity, partners, so on and so forth. I was led to this conclusion kind of based on what the patient was asking with mono, and learning about some things online about how sexually transmitted diseases present or UTIs present, and how kidney stones present in general. So kind of trying to get more of a general understanding of how these things occurred, if the patient had noticed any of these things, kind of a very good background on those to either rule them in or rule them out as my differential diagnosis. Another thing that I thought went really well was the auscultation and palpation of both the lungs and heart, the auscultation of the lungs, heart, and abdomen, and then the palpation of the abdomen as well. I'd only had a couple times in class that we really went over this, so to be able to remember and kind of walk through each step and make sure that I knew, like, it really reassured me that I knew what I was doing, and I felt really good about it, and did it with a purpose, palpated with a purpose, auscultated, and heard what I was supposed to be hearing. But like anything good and bad, so some of the things that I've noticed that I had forgotten to do or that I wish would have gone better is, one, with the thermometer, couldn't really find a cover, realizing, hey, I'd always used the ones with the plastic probe cover, so not really seeing that. Didn't use a probe cover, so I realized I need to do that now, and kind of, I had looked at the bag of them and been like, that's very interesting, and don't know what that's for. Looking back, realizing that that's what they are, and kind of got into the clinical site and tried to use them on patients that I have, or just practice with them. The other thing was, I don't necessarily believe that my treatment options were bad. I just realized that they weren't the best that they could be. So definitely going forward, I want to make sure that I learn more about the treatment options. I know for this patient there really was kind of the old flu adage of treatment options, but there's also other things that could have gone on that would have warranted a referral. Finally, I guess this patient, really, things that I did with this patient or didn't do with this patient that will stick with me is when we're debriefing, kind of talking about the general symptoms of mono. The biggest one to look out for was, yes, they could present with all the things of the flu symptoms, but they really have that sore throat and kind of the white pesticles on the throat. So looking for that and specifically asking about it and looking for it, I will remember to do if I ever suspect that the patient has mono and that they're probably tender on the spleen or the left upper quadrant. The other thing, again, so kind of touched on it already, is learn how to use the thermometer covers that aren't just the plastic probe ones, and just kind of practicing putting those on thermometers that I hadn't really practiced before. So again, my name is Robert Pollock, and this was the standardized patient encounter reflection video for the first standardized patient on the general medical condition. Thank you. Bye-bye.